Now on the morning show from the PIIC Center, sporting a new look, Dr. Vivek.
Good morning.
We didn't recognize you when you came in.
I recognized you right away.
I thought it was a haircut. I thought you had a haircut, and it is a haircut.
Yep, just the wrong place.
So how are things? You look well. Things good?
Yep, things are better.
Good.
I mean, I think we are seeing less of the COVID issues, but as with anything in infections, there's always something new.
Yeah.
I think with the campaign, the election, the news about COVID has really fallen way off the front page, particularly about what is happening with COVID in the rest of the world. And I know you have relatives in Asia. What's the status of COVID elsewhere?
Also, the numbers, especially in Europe, seem to be going up, but thankfully, hospitalizations are not going up. And in a lot of the world, kind of like here, people have given up on COVID and gone to the next thing. I think most people are over and done with the pandemic. I mean, I think, as we kind of discussed before, it's going to be like a regular respiratory virus with certain complications that are not with the flu, especially the blood clots and all the other stuff, and the long COVID, which we honestly don't have too much data on. Who's going to be the one who develops long COVID? How do we treat it? What do we do with those patients? So there's more to come on that, but there's other infections as always.
So over 22 states are reporting an increase in hospitalizations for children with respiratory viruses, and we know they're going around everywhere, of course, this time of year. Why is the hospitalization necessary? Is there a more severe respiratory illness going around, or is this common?
I think towards the beginning of the flu season or the respiratory virus season, you tend to see a slight uptick in numbers in terms of kids who get sick. The other issue is with the vaccination brouhaha that happened, I think kids as a general rule have had less vaccinations for all their infections, and therefore the lack of vaccinations plus the fact that we are now kind of mingling around a lot more than we did for the last couple of years, there's been an uptick. And there's seasonal kind of variations in what the respiratory viruses do. And my take is for 2 years, kids hadn't been exposed to other kids with respiratory virus. So when they're getting it this time around, they're getting it somewhat severe.
Yeah, it's interesting. I learned something new this week, that you can get strep throat without having a sore throat.
Well, you can get strep colonization. So there's you can have strep in your throat without having overt pharyngitis.
Okay.
So typically, we don't tend to test individuals for strep unless you have some sort of symptoms. So if you have symptoms, you get tested. If you don't have symptoms, then you won't get tested, but you might still be carrying strep in your throat. And let's say if you have a kid at home who gets recurrent strep, often it's somebody close enough to them who has strep, who's colonized with strep and doesn't know it.
Interesting.
So sore throat, that to me was the
That's what I
symptom.
thought it was,
I thought
yeah.
the symptom would be, but besides a sore throat, what are the...
I think the big thing is typically a sore throat, trouble with breathing, high fevers. We frequently see kids with high fevers who don't have a sore throat, and then when you look inside their throat, they have the white pus pockets in their throat. So that tends to be the most common. But strep that causes strep throat can also cause skin infections. In adults, that tends to be the most common presentation of strep.
What are the treatments for, do we call respiratory illnesses RSV? Is that what we call them?
Well, so that's one of the viruses.
One of the viruses, yeah.
So there are multiple viruses. It's kind of like broth of viruses that are circulating around in preschools and schools, and your kid tends to get one or all of them.
One thing we also stopped hearing about, monkeypox. Did it just go away, or is it another one of those victims of a changing news cycle?
I think it's disappeared. Well, I won't say it's disappeared, it's certainly decreased in number. I mean, I think the big thing to realize is there are lots of viruses floating around, but the one that is most efficient are the ones that are based on respiratory stuff. So those, because monkeypox, close contact, sexual intercourse, those are the ways you're going to get it. And those things can be managed. You can't manage breathing.
Right.
So if you could stop breathing, that would help, but unfortunately, the outcome tends to be not too good.
What are the treatments for kids, or what should parents be doing? I know antibiotics get prescribed a lot of the times. Just the normal rest, hydration?
Rest, hydration. I think with most of the respiratory viruses, with a few exceptions, let's say COVID and flu, there aren't too many good treatments around.
Yeah.
So you just stay home.
Is it high transmission of these respiratory? Is that how?
Yeah, I mean, I think the trouble tends to be any infection that involves your upper respiratory tract. Each time you breathe, you're kind of spreading it to people around you. And if your immune system is weak, or if you haven't been exposed to a lot of these viruses before, you're going to get it. Some of them, even if you've had them before, you can have them again. And therefore, you tend to get sick multiple times a year, as any parent of a young kid who's going to preschool.
What do you recommend for testing? Because like you said, kids come home with some type of weird look on their face every day. How do you know if flu, COVID, or you recommend testing, and then when do you recommend testing?
I think if the kid doesn't get better in a couple of days, I would definitely get tested.
Okay.
My take tends to be, and I'll maybe an outlier in there, often the ones that you want to be sure that your test are COVID and flu, because there are treatment options for those. Mm-hmm. For the other ones, there aren't too many treatment options. So if your kid is immunocompromised, meaning that if he has any condition that kind of makes him more susceptible, then definitely get tested for RSV, because there might be treatment options that your physician might offer. But for a lot of the respiratory viruses, you get miserable, you can make your parents miserable, you have them stay at home, and then you get better.
One thing that we did as a society, we got pretty good at conducting complicated medical tests at home. Is it a possibility that we'll see more in the way of home tests for things like strep throat?
I think that is where a lot of research is going on. I mean, realistically, that would be the ideal way. I mean, I think the fact that you have to go to an urgent care or a physician's office to tell you that you have a disease, and then they'll tell you that stay at home and rest. You could probably be a lot better if you stayed at home, got your test yourself, and said stayed at home.
Right. Yeah. How many times have we left with those instructions?
Yeah. Well, it seems like now that we at least learned how to, do a swab and test it in chemical.
I think the pandemic also made people feel like the second they get sick that they're going to die too. So I think you also have that section of the population as well. So it's interesting what the pandemic kind of did to us, for sure.
Dr. Vivek is with us, infectious disease specialist at the PIIC Center and Henry Ford Jackson Hospital. More with Dr. Kak in just a moment.
Over time, we've seen more and more people frustrated with their dental benefits. They thought that because they had dental insurance, they'd be well taken care of. Well, that's exactly what the insurance companies want you to believe. They figured out a way to collect your premiums while continuing to limit your choice of doctor and your choice of treatment. There's not one company better than the others. They've created an environment where dentists diagnose treatment or recommend care based upon your insurance dollars available. That's not the way people should be treated, and we think there's a better way. We put the interest of you and your family first. We take the time with you to figure out how to get the care you need, whether it's with your insurance or not.
We are Dentistry by Design, and our mission is to make excellent dental care a joy. Please call, visit the website, or drop by the office. We'd love to answer any questions you may have. And be sure to ask about our exclusive membership program to help you save on the cost of your dental care.
Insurance companies are bragging all the time about their convenient photo app programs. The only convenience or advantage is to the insurance company. On average, these claims are shorted by thousands of dollars. If your insurance company requires you to take photos to get paid, let Trips help. We'll take the photos, we'll write the estimate, so you get paid what you deserve. And we do this at no charge. Even if you don't have us fix your car, we can help. At Trips Auto Shop, the right repair is no accident.
Collins Brothers floor covering in 15 seconds. Plush carpet, pattern carpet, commercial carpet, carpet tile, ceramic tile, porcelain tile, glass tile, decorative tile, floor tile, wall tile, shower tile, subway tile, marble tile, wood tile, vinyl tile, and much more. Collins Brothers downtown.
Best of Jackson Award winner Laughlin Slice of Spice invites you to experience the best pizza you've ever had. Pizzas, sandwiches, soups, salads, appetizers, all prepared fresh for lunch and dinner. Take out or dine in our comfortable, spacious, sparkling, family-oriented dining room. Choose from our extensive wine list or enjoy a frosty mug of cold beer. Superb service, fantastic award-winning cuisine. Taste the difference. Open late on Friday and Saturday, all day Sunday. Laughlin Slice of Spice in the Village Crossing Mall on M60, just 4 miles west of Lumen Christi.
Open your Michigan-made checking account with True Community Credit Union. When you open a Michigan-made checking account, you can earn up to 3.5% APY each month based on the activities and relationships you have connected to your account. The more points you earn, the higher the rewards. Plus, there's no minimum balance or monthly fee. Visit trueccu.com to open your Michigan-made checking account today.
Welcome back to the morning show. We're with Dr. Vivek from the PIIC Center, Infectious Disease Specialist, and we're talking respiratory viruses, COVID, flu, and flu. This is going to be probably a pretty big year for the flu.
Yeah, definitely a lot bigger than the last couple of years.
Yeah.
So, especially since we are now kind of unmasked, this is going to be like a regular flu season. Slightly worse because we haven't been exposed to a lot of flu for the last couple of years.
And I think I still see people wearing masks, and I know there's still kids who are wearing masks in school, but a handful doesn't protect the whole population.
It doesn't, but I think if you wear a mask, you're at least decreasing your risk of catching something marginally, but you're probably decreasing it somewhat. So
We talked, I think, in the middle of the pandemic that we were going to see masks be a permanent part of certain things. Airplanes was one of them, that of course didn't pan out. But hospitals, healthcare facilities, we're still seeing.
Yeah, we're still seeing masks in a lot of, at least up here. I know in certain states, I think they've kind of loosened, even within the healthcare setting, masks. But a lot of the healthcare providers are kind of pushing back against that, partly related to the fact that these days the most likely way you're going to get COVID within the hospital is if your family members come in and bring COVID. And then the trouble tends to be your healthcare provider. If he's unmasked, he's going to get it. Now, they might not get as sick as they did 2 years ago, but the trouble is then they're out for 5 days, mandatory, and another 5 days with masks. So there's a lot of issues with just not having enough bodies to do the work that is needed to happen in the hospitals. And I think that's across the board with all industries. If you have COVID and you get tested, a lot of workers are not telling anyone that they have it because they know that they'll be told to stay home for 5 days.
Yeah, and of course that's been going on, I think, probably since the start of the pandemic. At the PIIC Center, what's new? What are people coming in and getting treated for?
I think it's kind of the same run of the mill. Lots of skin soft tissue infections, those that are independent of COVID and respiratory stuff. So we see a lot of those all the time, kind of. Because people are still exposed to a lot of bacteria. We have still people who are diabetic, who step on nails.
And with COVID, we got new treatments, pills, infusion. What are the reasons that someone would get a treatment versus writing it out?
Well, if you have anybody who had severe risk factors for worsening of disease, so if you're older, definitely if you're unvaccinated, if you're immunocompromised in any way, shape or form, whether from steroids, whether from cancer treatment, you should definitely think about treatment. And the options are obviously the pill, the Paxlovid, which you should get within the first 5 days, or the monoclonal antibody, which you can get within the first 7 days. So I think the key tends to be if you're anyone who has risk factors for progression, you should definitely get it.
Are most of the patients that you treat vaccinated or unvaccinated?
Most of the patients these days are vaccinated, but most of them haven't had the booster.
Right.
So I would say most of them are under-vaccinated.
Yeah.
How many people are in the hospital being treated for COVID?
I think it's in the double digits right now.
Wow.
So I think, and it's kind of gone up a little bit, but it's not like what it was a few. And most of those individuals who are in the hospital with COVID also tend to be ones who come in for something else and are found to have COVID incidentally.
Are we using ventilators?
Not as much as before.
Well, that's good. Very good.
Great. to have you here. Thank you.
Yeah,
Thank
thank you so
you.
much. Appreciate it.
Infectious disease specialist from the PIIC Center and Henry Ford Jackson Hospital, Dr. Vivek. More of the morning show after this.